Hello, Dr. Stephanie Gray with the Integrative Health and Hormone Clinic and Your Longevity Blueprint. And today I want to talk about vitamin K2 specifically. I'm very excited to share that in December of 2018, Mindbodygreen published an article that I wrote on vitamin K2, and I want to review some of the same information I included in that article with you today, and I'll post the link to that article at the end of this blog. So, have you ever heard of vitamin K? It's often overlooked, but it may be one of the most important nutrients for your health. So vitamin K is one of the 4 fat-soluble nutrients, or vitamins I should say. A, E, D, and K are the fat-soluble vitamins. You may be aware that vitamin K does guide calcium safely into the bones to strengthen bone mineral density and reduce fractures. But the good news is, beyond that, it also prevents calcium from accumulating in your vessels and can even remove dangerous calcifications. So how does this relate to heart disease? Well, if you've ever heard of the coronary calcification score, this test checks for calcium buildup in your coronary or your heart arteries. A high score means you're at high risk for heart disease. And I have patients all the time present in my office having had this test done saying, I have high risk, what can I do? They think they're on the way to a heart attack, and that actually may be the truth. So the more calcium built up in the vessels, the stiffer the vessels. You want your vessels to be more stretchy and more elastic, and not only can K2 prevent these calcium plaque heart blockages, it can actually also improve arterial stiffness and elasticity. So, if you really want to dig in and learn more here, I suggest reading a very great book on vitamin K2 called Vitamin K2 and the Calcium Paradox. And here the author, I'm not sure how to pronounce her name, Kate Room Blue, who's a naturopath, says it best. She says, whether your cholesterol is high or low, what really matters is whether calcium plaque is building up in your arteries, leading to these potentially fatal blockages. So vitamin K helps direct calcium to the correct and beneficial places for your health, keeping it away from the wrong places that can be detrimental to your health, like your arteries. So how does vitamin K really accomplish this? It activates important proteins like the matrix GLA protein, which we call MGP. So this is where the magic happens, keeping calcium from depositing into blood vessels and even other soft tissues. So, in fact, the Rotterdam study, published in the Journal of Nutrition in 2004, showed that individuals with the highest dietary intake of vitamin K2 will live, on average, 7 years longer than K2 deficient individuals. Why? Because this reduces the instance of arterial calcifications, right? Now, there are differences with vitamin K. So there are a couple different, you may have heard of, types of vitamin K. There's K1 and K2. So K1 is known as phyloquinone and K2 is known as menaquinone. K1 deficiency is actually really rare because you find that in many leafy greens like kale, collards, spinach, turnip greens, beet greens, broccoli, and Brussels sprouts. And as long as you're getting some greens in your diet, this is probably not a deficiency you need to worry about. Vitamin K2 deficiency, on the other hand, you do need to worry about. So vitamin K2 comes from specific foods and bacterial synthesis. So because of that, many individuals are deficient in K2 and often don't even realize it. So it was previously believed that we didn't need to supplement with K2 because our gut bacteria should be able to make it. However, the amount produced really can vary person to person. And you have to have healthy gut, really healthy bacteria there for the process to happen. And if you, like many others, have ever taken antibiotics or have suffered from gut infections or food sensitivities, you may not have ample K2 production in your gut. K2 is not stored in the body, so we need to consume it routinely through foods or through supplementation. So what foods can you find vitamin K2 in? Well, fermented soybeans, which many of us are probably not consuming, as well as fat, milk, organs of grass-fed animals. So this would even include egg yolk, butter, and even liver. Now, much of our livestock, unfortunately, is no longer grass-fed, which is going to reduce the K2 concentration in the foods they produce. So in the book that I mentioned, the author says, when we removed animals from the pasture, we inadvertently removed K2 from our diets. Why? Because chlorophyll, which is the pigment that makes green plants green, right? That's what cows, for instance, are consuming when they're eating green plants. They're ingesting the K2, or the K1, which they should be converting to K2, which then we consume, right? But only the grass-fed animals have likely converted that for us. So we don't have to. So wild game like pheasant, duck, rabbit, venison, elk, boar, and wild turkey may eat green vegetation, which can increase the K2 from the foods that they produce and we eat. So which is why we really should be looking to consume the wild game, these animals that are actually grass-fed, right? And this makes another example of Michael Pollan's statement, "You are what you eat" eats, really true. But think about it, a lot of the meat we're consuming is not grass-fed, and that's a problem, and that's why our K2 consumption has really gone down, and many of us are K2 deficient. Now, you may know that heart disease has been known as a silent killer, but you may not necessarily experience classic symptoms of a K2 deficiency, right? So we know that many cancers, osteoporosis, even we're finding infertility, varicose veins, diabetes, wrinkles, dental cavities, Crohn's disease, heart disease, like I mentioned, and even kidney stones can be associated with a deficiency in K2. Now, this all may sound fine and dandy, but you might be wondering where vitamin D plays a role. So vitamin D fits in because it increases the absorption of calcium from the intestines. But unfortunately, once vitamin D makes it into the bloodstream, it has no control over where calcium goes. Some will end up in the bones, some may end up in the arteries, some may end up forming kidney stones, right? Nobody wants those. Think of vitamin D as the doorman, opening the door for calcium to enter the bloodstream. Think of K2 as the usher, which takes calcium from the lobby and directs it to the appropriate seat in your bone matrix. So K2 helps bind calcium into the bone and synergistically works with D3 to improve calcium absorption. So taking vitamin D increases your body's need for vitamin K2. That means if you supplement with vitamin D, vitamin D3 hopefully, your body is also likely going to need K2. So how can you supplement if you can't get this K2 from food or from what you eat, right? Well, there are two different types of supplements, Mk4 and Mk7. Mk4 is typically extracted from a tobacco plant, and the downside is that it has a very short half-life, meaning it doesn't stay in the body very long, really only a few hours at the time. So instead, we recommend supplementing with Mk7. This is typically sourced from natto, which is fermented soybeans, geranium, or ours is from chickpea. It has a longer half-life, so a single daily dose can provide longer protection for you. And the effective studied dose is at least 90 micrograms per day. Many studies have used 180 micrograms per day. Now, Mk7 at this dose should not significantly interfere with blood thinning benefits of drugs. However, please always share with your medical provider of all the supplements and medications that you are taking so they can monitor these effects. If your mind is reeling after this long video, let me break down the takeaways here. So getting enough K2 in your diet really boils down to having proper gut health, eating the K2-rich foods I've mentioned, and taking K2 supplementation, specifically Mk7. Having the right amount of K2 is not only beneficial for your bones, but it protects your vessels. Remember that K2 is essentially the usher that directs calcium into all the right places, avoiding the wrong places like our arteries. So here at the clinic, we carry K2 alone, vitamin K2. We also carry vitamin D3 with K2 in a capsule and also in a liquid form, so even children can take this. You can learn more about nutrients like K2 in Chapter 4 of my book, Your Longevity Blueprint. And again, always consult with your healthcare provider and share any supplements that you're taking. Thank you for tuning in. Thank you for listening to this long video. I'm also going to post the link to the Mindbodygreen article with all of this information at the end of this blog. So please like and subscribe to our YouTube channel. Tune in again, and remember that wellness is waiting.